Foodborne diseases is caused by consuming food or beverages that are contaminated by disease-causing microbes. They are infections caused by a variety of bacteria, viruses, and parasites. Of note, many foodborne pathogens also can be acquired through recreational or drinking water, from contact with animals or their environment, or through person-to-person spread. 90% of all foodborne illnesses are caused by these pathogens: Salmonella, norovirus, Campylobacter, Toxoplasma, E. coli, Listeria, and Clostridium perfringens.
Common symptoms of foodborne illness are diarrhea and vomiting, typically lasting 1 to 7 days. Other symptoms might include abdominal cramps, nausea, fever, joint or backache, and fatigue. Bacteria and viruses are the most common cause of food poisoning. The symptoms and severity of food poisoning vary, depending on which bacteria or virus has contaminated the food. Here are some examples of bacteria which cause foodborne illness.
Botulism is a rare but potentially life-threatening bacterial illness caused by Clostridium botulinum. The bacteria grows on food and produces toxins that, when ingested, cause paralysis, starting with the eyes and face and moving to the throat, chest, and extremities. Symptoms of having botulism are nausea, vomiting, fatigue, and dizziness. They generally appear 12 to 72 hours after eating contaminated food. With treatments, illness lasts from 1 to 10 days. Full recovery can take weeks to months. Some people even never fully recover.
Salmonella infection or salmonellosis usually occurs when a person eats food contaminated with the feces of animals or humans carrying the bacteria. Foods that are most likely to contain salmonella include raw or undercooked egg and meat, raw milk, and contaminated water.
Staphylococcal food poisoning is caused by Staphylococcus aureus. This is a type of bacteria commonly found on the skin and hair, as well as in the noses and throats of people and animals. Food poisoning can occur when a food handler contaminates food and then the food is not properly refrigerated. These bacteria multiply quickly at room temperature to produce a toxin that can cause illness, and it will be killed by cooking.
Escherichia coli O157H7 is one of the several E. coli strains which produce Shiga toxin and cause hemorrhagic colitis or E. coli infection. Transmission of this bacteria normally through contaminated water, raw milk, raw or ground meat, unpasteurized apple juice or cider, or even person to person. E. coli symptoms change as the infection progresses. The symptoms usually begin 2 to 5 days after infection, including the sudden onset of cramps and abdominal pain, followed by diarrhea within 24 hours. People with E. coli infections also often feel nauseated and experience headache. Less common symptoms include fever and chills.
Lastly, food safety is extremely important to prevent foodborne diseases. You can prevent most foodborne illnesses when you know and use proper ways to handle, store, and prepare food.